Well, stretching's good for you. At least that's what you've been told until now. Your stretching routine may actually be doing more harm than good. To explain, I'm joined now once again by Brendan Fox, head trainer at Medcan Clinic. Of course, that's right across Canada. So let's talk about this because I do stretch. I've had a few injuries this year, and I was told stretch it out and they will go away, but they just compounded.
So stretching can absolutely be beneficial.
Yes.
It can improve your joint range of motion and potentially prevent injuries. And if you think about a joint, you know, the muscles hold the joint together, and oftentimes if your muscles are too tight, if you imagine pressing your hands together, it can make it harder for the joint to function. So that's one of the main benefits of stretching. But what's happening with stretching is it's not being applied in the right way.
Okay, so when do you stretch?
So it all depends on the type of stretch you're doing. To start, there's two different types of stretching. There's static stretching, which is where you hold a muscle in a stretched position for about 30 seconds.
Okay.
And then there's dynamic stretching, where you're stretching a muscle in motion. And what happens is, contrary to what we all learned in gym class many years ago, static stretching actually weakens the muscle in the short term. So if people are holding stretches prior to exercise, you're potentially decreasing your performance because you're decreasing your strength.
Okay, break that down a little bit because I know what you mean.
So what happens is, if you're going to be doing stretching to prepare you for exercise, make sure all your stretches are stretches that are done in motion with movement.
Okay.
Don't be holding stretches, because if you're holding a stretch, that'll actually weaken you. That type of stretching is best done after the fact.
Okay, so
as a cool down for improving flexibility.
Okay, so warming up, how long should your stretching then last?
So you should do about 5 minutes of dynamic stretches in motion as a warm-up.
When I've warmed up before a workout, because I do a lot of weight training during the week, I hop on the bike for a good 5 minutes, and that's how I warm my body up. I don't stretch before, I always stretch after.
Yeah, so I'd say hopping on the bike is good for getting the heart rate up, improving the temperature of the body, but it's really just legs.
Right.
And I'm assuming you're exercising your whole body, so I would encourage something that's more head to toe.
Right.
And that's going to get all the joints loosened up. Now, the main problem with stretching too is that people take the machine gun approach to stretching.
Yeah.
So they just assume you just stretch everything out. Now, when I see people at the clinic, we actually do individual assessments just to determine which muscles should be stretched.
Right.
So, for example, here's a static stretch example of the hip flexor.
Yes,
hip
which
flexor
I
is
have
one
major
of the,
problems with.
yeah, it's one of the main areas to stretch because it actually attaches to your low back. So when it gets tight, it can create a lot of low back tension. And a very tight hip flexor can also rotate your hip forward. This is an example of a chest stretch. The chest is another main area for viewers to stretch out because it's chronically tight in people, and what happens is it'll pull your shoulder forward and create a lot of problems with your shoulder mechanics, a lot of pain symptoms. And this is an example of an exercise you do before, or a warm-up you do before exercising. This is leg swings, and that actually decompresses your spine. So it only takes a little bit of pressure on the nerves in your spine to decrease your muscle function. About the amount of pressure of a dime on your skin. So if there's any compression in your low back, that can actually impede the proper contractions of your muscles. So one of the main things that I'm constantly explaining to clients is there's a difference between a muscle that's short and tight and long and tight.
Right, okay.
So what happens is, if you imagine that this is a joint, my two fists are a joint, and the elastic in between is the muscles, then what happens is, you know, if that joint becomes loose and compromised, the elastic or muscles may be tight, and people would assume you stretch it out.
Right.
So because it's a tight muscle. But what happens is if you stretch that out, you give more momentum to that joint to become looser. And so that's how stretching can create a bigger problem. So it's important to identify why you're stretching the muscle. And I often say, you know, people should be prescribing stretches like you're prescribing a drug. If you prescribe the wrong stretch, you can get a bad side effect.
Right. Okay. So does it change then, depending on the workout, if you're doing a weight workout versus, let's say, a running workout, a cardio workout?
It would change to some extent. The ideal is to get your body mechanics aligned. So for some individuals, there's certain stretches they should be doing regardless. If I'm giving somebody a weight workout, I would have them stretch the hip flexors out because that allows the low abs to function better when they're doing their core workouts. However, if you stretch out your hip flexors before running, hip flexors are the main muscles used in the running movement. You're actually weakening that muscle and thereby decreasing your performance.
I can attest to this. I did not stretch out my hip flexors and had to take, 12 weeks off of working out because everything went. My back went, every part of my body went out of alignment. It was a dreadful, dreadful injury.
Absolutely. One of the main things is hip mobility.
Yes.
As far as stretching goes, because if you lose some mobility in the hips, if you get tight muscles in the hips, your spine rests on your hips. especially if you get tight on one side, you create an unlevel pelvic platform.
And then you go on the treadmill and you knock everything out there,
Yeah.
and it's just a domino
Yeah,
effect.
and then what happens is sometimes, the site of pain isn't even the cause of pain, because you can get tight in one hip flexor, and if you imagine like the connective tissue in your body, tightness down here can pull and create some tension in areas very distant from the tight muscle. So a lot of times, people are treating symptoms of another problem located in the body, which could be a tight muscle in the hips.
Maybe it's just that I'm old.
Maybe it's just that attitude.
Maybe it's just that attitude.